So that's what we're going to do in this explainer. We're going to break down what diabetes is, how it works, the different types, the warning signs, and most importantly, how you can get a handle on it.
All right, let's get right into it. The official name is diabetes mellitus. At its core, it's a chronic disorder of your metabolism. And the main problem, the big issue, is that your body can't manage its blood sugar properly, which leads to way too much sugar in the blood. That condition is called hyperglycemia. But to really get why that's a problem, we've got to understand how our bodies are supposed to handle sugar in the first place.
Okay, so let's think about it this way. Your body is like this incredible high-performance engine. And just like any engine, it needs fuel. For us, that fuel comes from the food we eat. So here's how it's supposed to work. Step 1, you eat something. Your body gets to work breaking that food down into glucose. That's the high-octane fuel for your body. Next, that glucose gets into your bloodstream so it can be delivered everywhere. But here's the thing. To get that fuel out of the bloodstream and into your cells where it can be used, you need a key. That key is a hormone called insulin, which is made by your pancreas. Insulin is literally the key that unlocks the doors to your cells, letting all that glucose rush in to give you energy. When it's all working, it's a beautiful, perfect system.
So what goes wrong with diabetes? Well, this really elegant system can break down in two main ways. First, your pancreas might just not be making enough insulin. You literally don't have enough keys to go around. Or, second, the cells themselves can start to ignore the insulin. The key is there, trying to unlock the door, but the lock is all rusted up. This is what we call insulin resistance. In either scenario, the result is exactly the same. The glucose can't get into your cells, so it gets stuck and builds up in your bloodstream.
And this gets us to something really important. Diabetes isn't just one single thing. It's more of an umbrella term. There are 3 main types, and each one has a different root cause.
Okay, let's break these down. First, you have type 1. This is where the pancreas it stops making insulin, period. That's why people with type 1 are dependent on insulin injections. It often shows up in childhood, but it can happen at any age. Then you have type 2, which is by far the most common. This is caused by that insulin resistance we just talked about, the rusty locks. It typically develops in adults, though we're seeing it more and more in younger people, which is pretty concerning. And finally, there's gestational diabetes. This is a type that's diagnosed during pregnancy, and in most cases, it goes away after the baby is born.
So how would you even know if your glucose levels are getting too high? Well, your body has some pretty clear ways of trying to send you a warning signal. You just have to know what to listen for. You know, some of the classic signs you hear about are things like needing to go to the bathroom a lot, feeling incredibly thirsty or hungry all the time, or even losing weight when you're not trying to. You might also just feel wiped out and fatigued, have blurry vision, or get a weird tingling or numbness in your hands or feet. These are all signs that your body is struggling to get its fuel to the right places.
But, and this is so important, especially when it comes to type 2, these symptoms can creep up on you so slowly that you might not even notice them. In fact, a lot of people show no signs at all. This is why it so often gets discovered by accident during a routine checkup, and why regular screening is just so important.
So that leads us to the next big question. How do doctors actually diagnose this? And more importantly, why is catching it so critical for your health down the road?
A lot of the time, the diagnosis really comes down to a few key numbers from a simple fasting blood glucose test. If your level is under 100, that's considered normal. If it's 126 or higher on 2 separate tests, that indicates diabetes. Now, that zone in the middle, from 100 to 125, that's called pre-diabetes. Think of it as a warning light on your dashboard. Your blood sugar is higher than it should be, but it's not quite in the diabetes range. Yet.
And why are we so focused on these numbers? Because, having persistently high blood sugar isn't something your body just shrugs off. Over time, it acts almost like a poison, slowly causing damage to the tiny, delicate blood vessels and nerves that run through your entire body. And that damage, it creates this massive ripple effect. It's a leading cause of kidney disease. It's the top cause of blindness in adults. It can lead to severe nerve damage. It also dramatically, and I mean dramatically, increases your risk for heart disease and stroke, and it can cause foot sores and infections that are so bad they sometimes require amputation. The stakes for leaving diabetes unmanaged are incredibly high. Okay, that all sounds really serious, and it is. But, and this is a big but, this is not a story about doom and gloom. Not at all. The last, and honestly the most important part of this whole thing, is about taking back control. I absolutely love this quote from the World Health Organization because look at how it totally reframes the conversation. It's not just about what doctors and medicine do to you, it's about what you can do for yourself. It says that the person with diabetes is the single most powerful resource in their own care. I think that's amazing.
So what does taking control actually look like? It's really about building your own personal toolkit. It starts with planning healthy meals and getting regular exercise, which actually helps your insulin work better. Of course, it means monitoring your blood sugar so you know your numbers. For many, it also means taking medication, either pills or insulin. But the foundation holding all of this up is education and support. Understanding your own condition is absolutely the first step to mastering it. And let's get super practical for a second. Take foot care. This might sound small, but because of that nerve damage we talked about, it is a huge deal for someone with diabetes. Simple daily habits, like just taking a look at your feet for any cuts or redness, always wearing comfy shoes that fit well, never walking around barefoot, these simple things can prevent incredibly serious, life-altering complications.
So, we've covered the science, the different types, the symptoms, the stakes, the management. What's the one thing you really need to take away from all of this?
It really comes down to this. Yes, diabetes is a serious, lifelong condition that demands your attention. But, and please hear this, it does not have to be a debilitating sentence. It's a condition that can be managed. Through knowledge, through proactive self-care, and by working with your healthcare team, it is absolutely possible to live a long, healthy, and really fulfilling life. The power truly is in your hands.